Hello, family and friends. Today, we will continue the discussion about colon cancer and look at the risk factors and signs and symptoms. At the onset, there may be little or no symptoms. So, here are some important symptoms you need to be aware of. Number one, blood in the stool or rectal bleeding, especially blood mixed in the stool and not just on toilet paper. Next, persistent changes in bowel habits such as constipation, diarrhea, or alternating patterns. Changes in stool appearance such as narrowed or pencil-like stools. Abdominal pain or cramping. Unexplained iron deficiency anemia. Unexplained weight loss. And excessive gas or abdominal distension. A critical point to understand is that these symptoms overlap with other gastrointestinal disorders. But anyone with blood in their stools, abdominal pain, altered bowel habits, unexplained iron deficiency anemia, or unintentional weight loss should have a colonoscopy performed, regardless of age. Studies show that time from symptom onset to diagnosis often ranges from 4 to 6 months, highlighting the need for prompt evaluation. Now, let's turn to risk factors. There are fixed risk factors and modifiable risk factors. Fixed risk factors are those factors that cannot be changed. They include age. Risk increases significantly after age 45 to 50. Though early onset colorectal cancer diagnoses before age 50 is rising, as I mentioned last week. A family history. Having a first-degree relative with colorectal cancer increases risk twofold. This risk is even higher if the relative was diagnosed before age 50. Inflammatory bowel disease, ulcerative colitis, and Crohn's colitis significantly increase one's risk, especially after 8 years of having the disease. Hereditary syndromes and other genetic conditions. Race and ethnicity. Black individuals and American Indian and Alaska Native individuals have higher rates of colorectal cancer. While early onset colorectal cancer is increasing across all racial and ethnic groups, the steepest increases have been seen among non-Hispanic white individuals. A prior history of colorectal polyps or cancer. A history of radiation to the abdomen or pelvis for a previous cancer treatment. Now let's switch gears and talk about modifiable risk factors, which are risk factors that you have control over and can be changed. Number one, obesity and being overweight. Both are strongly associated with an increased risk, particularly in men. Studies show that obesity increases early onset colorectal cancer risk by approximately 88%, while being overweight increases risk by approximately 32%. Childhood and adolescent obesity also increase the risk. Number two, physical inactivity. Sedentary lifestyle increases risk, whereas regular physical activity is protective. Number three, smoking. Long-term smoking increases both the incidence and mortality, whereas early cessation reduces the risk. Number four, alcohol consumption. Alcohol is a known carcinogen, and there is no established safe level. Heavy alcohol consumption, more than 3 to 4 drinks per day, significantly increases colorectal cancer risk. Even moderate consumption at 2 to 3 drinks per day increases the risk by approximately 20 to 40%. The evidence for risk reduction after stopping alcohol consumption is limited and may take 15 or more years to manifest. Number five, diet. High consumption of red meat and processed meat increases the risk. Number six, sugar-sweetened beverages, greater than 2 servings per day, more than double the risk of early onset disease. Number seven, the typical American Western dietary pattern consisting of processed foods, refined grains, and high-fat dairy increases the risk. Protective factors include fruits, vegetables, whole grains, fiber, and adequate vitamin D intake. Number 8, type 2 diabetes is associated with approximately 20% increased risk of developing colon cancer. Now that you know the modifiable risk factors, begin making changes to reduce your risk today by maintaining a healthy weight, exercising regularly, stopping alcohol consumption and smoking, eating more fruits and vegetables and whole grains, reducing your consumption of red meat and processed meat, limiting sugar-sweetened beverages, and lastly, if you experience persistent symptoms, especially rectal bleeding, abdominal pain, changes in bowel habits, or unexplained weight loss, consult your doctor promptly for an evaluation. Well, that's it for today. Join me next week. We will discuss the different screening modalities, including the updated recommendation to begin screening at age 45 for average risk individuals.